Do you experience pain and stiffness in the knee while waking up in the morning? Or perhaps you have been experiencing the pain and stiffness while walking or going for the staircase climbing. You may be experiencing the pain from the condition called the osteoarthritis. Knee osteoarthritis is one of the most common form of osteoarthritis that affects millions of people all over the world. But let me tell you one thing, you're not alone. In this video, I will be diving into the symptoms and causes of knee osteoarthritis and what are the best conservative options to treat knee osteoarthritis faster for long term. So you can better understand your condition and take care of your knee. Hi, my name is Ishan Arora. I'm a physical therapist from PriMovers, which is an online pain and performance rehab platform. If you're looking for in-depth information about the knee osteoarthritis, don't forget to check out free injury prevention knee osteoarthritis guide along with a program that you can start doing it at home. In this video, we're going to go deeper into the knee osteoarthritis. So let's dive in and understand what exactly happening in the case of knee osteoarthritis. Knee osteoarthritis is one of the most common form of arthritis. There are a number of areas which go into osteoarthritis, such as the knee, hip joint, hand, and the spine joint. These are typically the areas which tend to have the osteoarthritis faster than any other part of the body. The knee is comprised of mainly three bones, as you can see here. This is the thigh bone called the femur. We have the small bone right in front of the knee called the kneecap or patella. We have the leg bone called the tibia. There are cushions in the lower part of your thigh bone called the cartilage, which covers the lower part of your femur bone. We have the cartilage on the top of your leg bone, and we have the cartilage behind the small bone right here, which is called patella. In case of knee osteoarthritis, what is typically happening is there is wear and tear of these cartilages, which is covering and providing a cushion to these joint surfaces. And as a result of this breakdown, which is happening in this area, there is a pain, inflammation, stiffness in the joint, along with the crunching or grinding sensation that comes when you walk or going for the staircase climbing. So these are the typical symptoms of osteoarthritis, which is your inflammation, pain, stiffness, along with the grinding or crunching sensation that is coming in the knee. Now, as we know now, the knee osteoarthritis is a degenerative joint condition. That means as you grow older, there are chances that this cartilage starts to wear and tear effectively. This broken parts of the cartilage starts to come in the joint surface, restricts your joint motion, along with causing the pain and inflammation, grinding or crunching sensation. Now, another thing we need to understand is what exactly the root cause of this problem. There are a number of factors which results in as a root cause of this problem, but there are certain risk factors which contribute to the development of knee osteoarthritis faster, such as your age, genetics, gender, along with the repetitive stress that is coming to the knee, any trauma or injury that has happened to your knee joint. Along with that, there are other risk factors or causes which results in a knee osteoarthritis, such as the lack of mobility of your knee, hip, ankle, along with the stiffness in the muscles around the knee area or in the hip ankle area. And the last thing that we need to see is the strength of the muscles around this place. So if the strength of the muscles surrounding the knee area, such as your quadricep muscle, hamstring, and the buttock muscles, if we have the lack of strength in these muscles, there are good chances that you can develop your knee osteoarthritis faster. So these are typically the root causes of knee osteoarthritis. Based on what category you fall, you can develop the symptoms of knee osteoarthritis. In order to diagnose the knee osteoarthritis accurately, it's important that you get yourself ruled out and examined thoroughly by your physical therapist or your doctor. They will help you examine areas which are under stress in the knee and along with the other areas which are putting a lot more stress, such as your ankle or the hip area. Along with that, your doctor will let you know whether you have the lack of mobility in certain areas, such as your hip, knee, or ankle, with the lack of flexibility in the muscles and your weakness in the muscles around the knee, hip, or the ankle area. Your doctor may also tell you if you need to get X-ray, which helps in visualizing the bone structures, how much is the damage in the bone, or like is there any reduction in the knee area, or any compromise that is happening in the knee area. The doctor can visualize the bony structures with the help of X-ray. Versus in the case of MRI, the doctor can also examine the soft tissue structures such as your cartilages, your ligaments, and other areas which are under stress. But again, your doctor or therapist can guide you well whether you need an X-ray or the MRI. Else, your clinical investigation is sometimes good enough to rule out what's exactly happening in the knee and can start working on the symptoms and also start working on the long-term solution to your knee issue. There are a number of conservative options available to treat the osteoarthritis in the knee, but most common is the physical therapy, which involves improving your body functions around the knee area, such as improving your joint range of motion. As in case of knee osteoarthritis, we tend to see the decrease in range of motion because of those broken parts of the cartilage which starts to come between the joint surface. Along with that, your physical therapist can also help you improve the length of the tight muscles, such as the inflexible muscles, the hamstring, front thigh, front hip, and ankle area, along with improving the strength of your weaker muscle groups, such as your glute muscles, gluteus maximus, medius, and minimus muscle, quadricep muscle, hamstring muscle. Based on the examination, what you really need as a treatment, your physical therapy can guide you what exactly you need to be doing to treat the knee pain conservatively. There are other options such as taking the pain medication to alleviate or reduce the pain. But again, if you start working on improving your functions, as in improving your joint range of motion in the hip, ankle, and knee, along with improving the flexibility in the muscles and strengthening of the certain muscle groups which are weak, you can really start seeing the difference in your pain. Though you cannot reverse the condition completely, you can't reverse what has happened in the knee in terms of the breakdown and the cartilage. But what we can do is we can slow down the progression of this condition by working on improving the strength of the muscles, improving the joint range, and the flexibility of the muscles. If you'd like to know more about our 8-week program, which is tailored specifically for the knee osteoarthritis, and it's a video exercise based program that you get the exercise program in form of video in the app, and you can go in the description and look for the link to get started with the 8-week program to fix your knee osteoarthritis faster for long term. And if you have any questions, please don't forget to leave that in the comment box below. I'll be more than happy to answer your question and get you started in fixing your knee pain faster for long term.